Well, about 400,000 Canadians suffer a brain injury every year. That's 46 people per hour, according to Stats Canada. That's a big number. Local centres highlighting the importance of your brain's wellness. Melissa Scaman with the Brain Care Centre and Dr. Brian Rowe, a professor in emergency medicine at the U of A, join us this morning. Good morning, both. Thank you for coming in. And that is a very big number, Doctor. A lot of head injuries. And what sort of accidents do you see most commonly that lead to brain injury?
Well, it depends on each emergency department. It's slightly different, but we see a lot of trauma at the main hospitals here, and so motor vehicle crashes are a common cause of head injury. Okay. Sports and recreation, so everybody's heard about Sid Crosby having a head injury and a concussion, but it happens in minor hockey, junior A hockey, professional hockey, those kinds of things, but also sports and recreation for people in the community. So bicyclists who fall and hit their head, don't have a helmet, they have brain injuries. So there's a whole variety of things that can result in somebody having an injury to the head or neck area that results in minor traumatic brain injury or a concussion. Okay,
and in terms of minor head trauma and concussions, what sort of symptoms should people be looking out for?
Well, the traditional symptom is that somebody is observed to have a loss of consciousness. They fall down, they hit their head, and they're briefly out. Their level of consciousness is down. So then they wake up, they feel okay. Sometimes they have nausea and vomiting. If you vomit a number of times, we need to see you. Okay. There's other signs and symptoms that can occur: brain fog, headache, dizziness, those sorts of things occur. But even a non-head injury, like a twisting injury from a soccer ball hitting you, or being involved in a car crash, you don't actually hit your head, but you can still have a minor traumatic brain injury from the kind of coup contra coup injury.
Interesting. Okay, and Melissa, how does the Brain Care Centre help people in the community? And I guess tell us a bit about the Brain Care Centre.
Yeah, thanks for that. So the Brain Care Centre is located just kitty corner from the football stadium. And so we get patients from community referrals, also from hospital that come out. So we do outpatient rehab for adults. And so we do things like occupational therapy, mental health counseling, service navigation. So oftentimes people struggle with just getting back into daily life after a head injury. And so we help people adapt to their new lifestyle after a brain injury.
And what is the process like for people to come to your center?
Good question. So typically people can come to us on their own if they feel like they're having reoccurring symptoms after an injury. And what will happen is they can come to us, we will reach out to their doctor or to the hospital that they were at to get their medical information so we know what type of head injury we're dealing with. Or sometimes we'll get referrals from actual physicians themselves or the Glen Rose Hospital.
Okay, and you're working together. There's a series coming up that you have. Tell us about that.
Yeah, so we're putting on a speaker series in the coming months. Dr. Rowe is going to be speaking next week on Thursday, so we'd love to have the public come out to hear about different brain health topics. And what we're doing is really trying to prevent head injury. We don't want you to have to come to our clinic if you don't have to. So we do a lot of public education to try and reduce people's likelihood of head trauma. Okay,
and Doctor, a lot of these are preventable, a lot of these injuries and accidents.
Absolutely. We actually don't use the term accidents, because accidents imply that that's out of your control. These are largely preventable. If you're thinking about going for an e-scooter ride across the city, which is common, a helmet is going to prevent the majority of the head injuries that occur at that speed. Same with bicycling. We've been very successful in getting people to use helmets for cycling, and it prevents head and face injuries very effectively. It's not going to get rid of everything, because if you're going fast enough and you get launched forward, a helmet's going to protect you. You may still have a concussion, but that might have been a fatal head injury without the helmet.
Perfect. Well, I want to thank you both so much for coming in and sharing this information, and looking forward to the public speaking series that you have coming up.
Well, thanks very much.
Thanks much.
For more information, you can go to their website at braincarecenter.com.